session, which is titled Jazz in the Classroom. And I'm happy to invite panelists, Dr. Prashant Garg to come on stage, Dr. Helena Felipe, and Dr. Soumya. And Dr. Pranish is replacing Dr. Chiku, also on the panel. Please. We will need one more chair. We need one more chair here, please.
Or we can sit on the front itself. I think
Okay, you can sit in front. Yeah, that's fine too. Yeah. So, as the AIOS has decided this time, there will be an introductory slide for every speaker and the panelists. So, we'll pause at each slide so that you can get to know them and their achievements, and then we'll move on to the talk. That's my request to the audiovisual, that you keep that for about 30 seconds, okay? All right, so Dr. Prashant will be delivering the most important talk, which is how do you teach adults? So adult learning principles. Thank you.
Thank you, Meena. And first of all, thank you, Ophthalmology Foundation, as well as the All India Ophthalmological Society of India, for giving me this opportunity to talk about very important aspect of education, which is adult learning principles. I think we have all seen the phase in our life where we have experienced the learning as children, and then we graduated to learn as adults, and now we are participating in learning of adults. I think one thing that probably all of us will agree, that learning is not just the gaining of new knowledge, but a new knowledge through a transformational experience. And I think as a medical educator, we have ample opportunity to really experience what we learned the best. Something that you have felt in the clinics are one which are long lasting in our memory. I do not have any financial disclosures. The objectives of my talk will be to discuss with you how adult learners are different from pediatric or children, to describe some of the theories of learning, particularly relevant to adults, and then how do we apply that knowledge whenever we are dealing with adult learners. Now, before I begin my talk, I'd like you to pause for a while and think about what are important characteristics of adult learner. Just think about that. Do you think that the statement that I made, that adult learners are different than children, is it correct, and in what aspect they are different? What kind of classroom or training activities have been most effective for you as an adult learner? And then what are one or two activities that you usually include as an instructor, and we will discuss that in the discussion sessions. I think a typical educational experience that we had in our undergraduate medical school is this kind of a classroom. Professor walks in, start writing on the blackboard, in my time blackboard and probably PowerPoint in this time. Some of the good teachers used to ask questions to students in order to engage them. Typically, all the programs are where you have to cram a whole lot of knowledge from books, notes of the professors, or the journals in the library stock. And at the end, your learning was always assessed by a qualifying exam at the end of the semester or at the end of the course. I think all of us are also familiar with this reality that half of the class with some professor used to feel like the attendance is necessary, therefore I should be in the class, otherwise I don't care about what they teach or what they do not teach. And other half where the teacher is interested in and they just keep on writing notes so that they can recall them just before the exam. Even if the teachers were asking question, yet another experience has been there are some forefront students who will always raise hands and will hijack the entire class, not allowing other students to even participate or providing the food for them to sleep and ignore all the learning that is happening. So while the class looks that the teacher is interacting with the student, in a true sense, many students are not really participating. Now, it is a time when we all have become educated to reflect upon. We can teach the way we were taught, or we can teach keeping in view the way people learn. And I think here it will be important for us to recognize that teaching or training does not translate directly into learning. And the learning is not equivalent to performance in actual life situations. So let me come to the topic. Adults and children have different learning styles and different needs is a fact. This fact was first highlighted in 1968 by McCallum Nowell, who gave certain characteristics of adult learner. The adult learners are usually self-directed. They learn better if they know what is the relevance of the learning. And for that, they require an internal motivation. They all have prior knowledge and experience, and they very well relate to their prior knowledge and experience, any new knowledge that is put forth to them. The knowledge becomes more effective if it is task-oriented. If they are engaged in certain activity, they are able to understand that better. And all adults learn in an environment where they are truly respected. These are some of the differences between children and adults, and I need not go into the details of what the children learn, but you can see that on many fronts, the adult learners are different than children, and therefore the same strategy that we use to teach children cannot directly be translated to adult learning. Another breakthrough research came about transformational learning, and it reflected the psychological behavior of adults. And this is that whenever a new knowledge is put forth to adults, they go through a disorienting dilemma. They really question, is it correct what he or she is telling? No, I don't agree with that. And after some time, they start to recognize the discontent and the need to transform. And finally, they are able to integrate the new perspective into one's life. And the author described 10 steps through which an adult goes through in order to bring that change and make it as a part of their life. One another very popular theory for adults learning is by David Kolbe, who popularized the experiential learning. That is, adults learn better when they experience activity, and they learn better when they reflect upon that experience. So if we can incorporate providing experience, giving them opportunity to reflect upon, and then based on then reflection again try to it in real life situation, then that learning becomes permanent. As I told you, adults usually want to have a control on their learning, which includes right from goal setting to self-planning, self-monitoring, and self-evaluation. It is very well known that if you engage adults into different kind of projects or activity, then learning is far, far better as compared to giving them didactic. For example, now I am giving didactic, but if I could have combined some activity along with it, then I think the learning would have been much better. So the next question is that how do we apply this knowledge, these characteristics of adult learning principle into actual learning sessions that all of us are moderating? The first thing that we have to keep in mind that adult student must consider a goal achievable. If they believe it will be difficult, learning may not happen. And therefore, as a learner, it is our duty to really set those goals such that they feel that these goals are achievable, and don't not put them that this is so difficult, you will not be able to, or you will have to work hard and all of that. That's a negative connotation on that. As far as being respected is concerned, I told you that adult learners like to be respected, treated equally, allowed to voice their opinion, and to have a role in directing their own learning. So it is important that residents, when they come in our clinics, we treat them like future colleagues, make them feel part of the department, and involve them in social and department activities. The third characteristic is responsibility. And what do we mean by? The adults learner have self-concept of being in charge of their life, responsible for their own decision, and want to be seen as being capable of their responsibility. And to facilitate learning, it is important that we discuss with them learning goals, enable periodic assessment, provide periodic feedback, and help them to modify goals. Real world application. As I said, that adults want to relate all the learning into the real life situation, what we call as a sense of purpose. So provide learners a real life situation where they can exercise their learning and how the learning is going to be useful to them. For example, if we have to talk about the clinical signs that help differentiating different etiologies of corneal ulcer, you can talk that there are clinical signs that will allow them to identify etiological agent, and therefore a good clinical examination is must. Adults bring experience to learning and is well known, and therefore we can put the questions which are asking them, how will you manage this condition? How you differently manage these two different severity of corneal ulcer. Now that way, whatever new knowledge you are giving, they will be able to relate to their past experience and become better. See, do, teach. Adults are task oriented and like to be able to apply knowledge, and therefore we should involve demonstrations and opportunities for a student to do themselves and teach peers. And this is a very well known fact about learning, that whatever you do is retained for a longer period of time rather than listening or watching. And therefore, to enhance learning, organize contents around task. Clinical education settings are very ideal. Expose trainees to all the practical experience that you center. And for that, you can even consider small group activities that allows them a safe, collaborative learning environment. Another important rule is 70-30. In any lecture, a teacher should speak only 30% of the time and allow students 70% of the time. And that way you will be able to engage larger number of people. This is difficult in 10 minutes talk, but in a classroom setting that can be done. To summarize what we discussed, that adult learner need to gain the confidence by when we set the goals that are achievable. They want to be respected, responsible, and want to know how the new learning is going to be applicable in the real world. See, do, teach is a very good strategy to enhance the learning experience of adult learner. To conclude, adults have different learning style. To be effective, we need to modify our teaching practices. These are simple and inexpensive. Only thing it requires little creativity. Thank you very much for your kind attention.
Thank you, Dr. Prashant, for beautifully setting the stage and giving the tips on how to engage adult learners. At this juncture, I welcome Dr. Krishna Prasad from Joshi Eye Institute, another educator par excellence. I welcome other doctors who have joined us, educators who have joined us this morning. So what happened was about a week ago, Dr. Matenge from Rwanda, who was one of the other speakers, expressed her inability to come due to several reasons. And when we discussed this, Dr. Pranesh very sweetly agreed to pick up her topic and give the talk. And I'm really eternally grateful for that. So we're going to flip the order a bit. So what we thought is we will take a break between every two talks to have a discussion so that you could, as educators, share your experience or put queries out there and we can all learn from each other. So for the next talk is lecture skills, and I invite Dr. Pranesh, and there is his introduction as well. Thank you.
Hello everyone, good morning and thanks for joining us today on this pre-conference day, first day. It's not easy, but thanks for your efforts. So myself Pranesh, and you can see that this is going to be our agenda, which has been changed a bit like what Meenakshi ma'am was saying. So we have this lecture skills, flip class, and how to use technology. All these three would be dealt by me. I'm sorry for that you have to go through me for a long time. Hopefully we'll make it easier. So what we thought was I'll do the lecture skills and we'll try to play around a bit. That's fine. Yep. So what I did was I kind of consolidated the talks and put it like this. Right? This is going to be the three lectures. Right? So just to give an overview of what we are trying to say is that lecture skills. So the teacher is lecturing the students. We assume that the students are not learning beforehand. So they are partying. They are like this Bobby Deol in Animal. They are playing, partying, they're happy. Then they come to the next day for the class. They don't do anything. They either sleep or they listen. And they go home and read. So we're not sure what they're doing, but we assume that they are reading. That's the first case. So we'll focus on how can we lecture them when they don't have enough prior knowledge, right? When they don't learn before. And how can we use the technology to make their learning much effective in the lectures. And then we're going to flip it, which means that we're going to give them some homework so that they are reading beforehand. They're coming to the class so that we don't teach, but we rather engage them, make them participate, and then they go back and learn again. So that's what the whole picture is. So this is going to be the film. Okay, let's take one by one. The first chapter is lecturing skills. Probably the most used way, the most employed way of education in medicine and elsewhere is going to be lectures. How many of you lecture? Great. How many of you teach undergraduate students? Okay. Postgraduates? Optometrists, nurses? Okay, good. So yeah, we are teaching eye care professionals across various domains. So that will be really interesting to know. And all of you lecture. Do you think lecture is the most commonly performed way of teaching? Raise of hands. Okay. Do you think lecture is the most or the least effective way of teaching? Yes. The most commonly used, but it is the least effective. That's really unfortunate, right? But we'll try to make sure the lectures are more interesting. That's going to be the goal, right? This is my personal opinion or my take on the essential skills. I've kind of modified my previous talks on how to take lectures. I've kind of distilled the entire concept into these 4 E's: empathy, elementalism, engagement, and elocution. The first E is come early to the lecture hall. It took half an hour for me to find where this glass door is. So early, that's one E. Eat well, that's another E. But apart from that, the skills, first E. I think Prashant sir has beautifully laid out the foundation for me. He talked about the adult learning principles, which we can effectively apply. Empathy, simply put, putting ourselves, the teachers, into the students' shoes and thinking from their perspective. That's a key skill, actually. As a teacher, we are giving the message to the audience, right? So we have to ask, who is our audience? Who are they? Are they postgraduates? Are they undergraduates, optometrists, nurses? And what do they know already? And what they do not know. This is very important to understand. If we don't know, using technology, which we'll discuss later, can help in that. And how they want to know. Probably the most important question. How they want to know something. How they learn is not how we learnt. There's a big generation gap. I'm 30 years old, but I'm still saying there's a big generation gap between me and my students, right? And it's really interesting and really inspiring the way they learn, and it's important for us to understand how they are learning. And please note that not all students learn the same way. How student A learn is not equal to how student B learn. Okay, my grandmom will say all 5 fingers are not of the same size. Very philosophical, but profound truth. Not all of us are the same. All of us learn differently. All of us behave differently. So this is going to be the teacher. Let me present these 152 slides, and we will see the smiling faces, which is here, goes to frown, and some of them sleep. What do you think is the average attention span? Any guesses? Depend on the speaker. Yeah, of course, yeah. That's true. On average, not in the class, but average, like throughout. They made a study. 10 minutes? 8.25? You think that is minutes? Seconds. Exactly. We are an Instagram generation, Reels generation. So how we learned is not going to be the same anymore. Very different, actually. That's the first thing, understanding how they are learning. Because I'm learning a lot. Previously, I used to make videos which are 40 minutes on my YouTube channel. And I realized that nobody watches that. Okay? The average duration of watching is 1 minute. For a 40-minute video, 50-minute video, I was like, why am I struggling for 50 minutes talking? They just watch only 1 minute. But that's the truth. So, yeah. Technology, distractions, right? So we don't need this drilling machine to keep them distracted. Okay? Even we talking. Yeah, that would be a good idea. Drilling the ideas into the brain. Analogy, which we'll talk about that also. So that's the first thing. Because now what I'm doing is I'm trying to make these, let me see if I have got that. Right. It's me. I'm showing all my history to you, but anyways. This is what I'm trying to make now. Not 40-minute videos, but 1-minute videos. When I showed this to my students in UK, they said, we don't watch YouTube these days. We are TikTok generations. Then I made efforts to open a TikTok account. Now I'm making videos on TikTok. So you can see that one. And they don't want all these things. They don't want faceless. They want face. So first is empathy, or understanding how our students are learning. The second is elementalism. It's kind of a philosophical thing. What I'm trying to understand is we are trying to split a big concept into small, easily to digestible chunks of information. That's what we mean elementalism. For example, there's a big molecule, you're splitting that into basic elements, giving the students simpler, smaller portions. And mind mapping, which we'll discuss in the technology, really facilitates that. This is one of the examples of the lecture, what I take for my students, undergraduates, as well as trainees. Take a big chunk and split into multiple pieces. It's one example. What I mean is, when we are teaching a topic, for example, I'm taking acute red eye, it is important for us to give them the bits and pieces of the topic. The differential diagnosis for acute red eye. That's one way to go about. Sometimes when we are going to talk a topic on acute angle closure glaucoma, it is important for us to go back and see what is the bigger picture. So elementalism means breaking a big component into different chunks and putting that chunk into the bigger picture. To give a bird's eye view, mind mapping is a fantastic tool to facilitate that. The eagle's eye view. The third E is engagement. And Professor Helena would be talking how to make the classes more interactive. But when I mean engagement, it's giving an example, reinforcing the concept. And that can be done by two ways, the story or analogies. Interesting, the story, you find that in history. Give histories, problem-based learning, the best way to stimulate the students' attention. Again, adult learning principle, like what Prashant sir was mentioning. Appealing to their practical relevance is the key. This is something which I really love, to bring analogies, to bring different creative ideas relating to the topic what I'm teaching. Right? So what I mean is that I'm giving you an example or a metaphor so that we are drilling the information into their brains, making it unforgettable. This is one example what I do. I recently started to learn cooking. So then I found that there are different pans available. When I saw those pans, I struck that, okay, looks like this glaucomatous damage, right? Progressive cupping. Yeah? So when you are in ophthalmology, everything looks like that. So I'm always trying to find a way to find an example. Medu vada looks like optic disc. But students in UK, they don't eat medu vada, they eat bagels. Okay? So I show them bagels, saying that this is going to be the optic rim, neuroretinal rim. That's the disc, and the central part is the cup, and this is notching, glaucomatous optic nerve damage. So tell them in a way which they can understand. It may be the silliest way, but it works. The last is going to be elocution. Elocution means that kind of an abstract thing to understand, but the whole point is when we know why we are teaching, when we understand who the audience is, when we understand how we should teach, and we know what we are teaching, that is going to be a clarity in communication. That comes into practice naturally. And when there's a clarity in the communication, we can be an elocutionist. We can be an eloquent, persuasive, fluent speaker. Thank you so much for attention. I hope I've given these E's. And there's going to be the next one, the another E, that is E smart, electronics, technology. That's going to be the fifth E, but which we'll have after this. So I would invite Meenakshi ma'am. Thank you so much for the opportunity and for the patience.
Thank you, Pranish. That was E, engaging. Yeah. And so let's take a pause now. And as we all talked about, lecture skills continue to be lectures continue to be one of the most important formats, fortunately, unfortunately. So I want to hear from the panelists. I want to hear from the other educators in the audience. What is your experience? What do you do? Any comments on these two talks?
I think for postgraduates, at least, lectures should not be the way around. I think it has to be a case-based discussion. Obviously, the theoretical crux of the issue, they need to break it down and extrapolate to real-world situation. It's always been, I think, our entire education system has been already in a faulty kind of a thing, because we always teach, even in the exams, we ask them, like a question is like etiopathogenesis, differential management of ocular sarcoidosis. No patient comes with a, head play that he's got a sarcoidosis. The question should be that, as you said, a red eye, like patient having vision loss in both eyes from last 1 hour. This should be the chapter heading. Vision loss for last 1 year. Vision loss of last 1 month. So because that is how the patient presents. So our students are finding it difficult to kind of extrapolate this information given in a thing, and then difficult to do the reverse engineering. I think we need to set this apart. Like, we should basically have a case. We should have have 5 cases. It can be the simple case that last 5 cases we saw in the outpatient. Could be a case of headache, could be simple, it may be a normal patient coming for a routine checkup. Any patient at 5 cases can be a case of a discussion. So in that, as you said, we can apply all these to probably bring out the ophthalmology. So that is where we are failing as lecturers. And we probably have that mindset whenever somebody starts lecturing, even at home it happens, we sleep off.
Thank you, Dr. Krishnaprasad. Would you like to add something, Dr. Helena?
Thank you so much for being here with all of you. Thank you, Ophthalmology Foundation, for the opportunity. Thank you, the marvelous speakers and the marvelous organization in all the topics, starting by the titles of each section, which are completely attractive and magnetizing. So this is just to speak that, well, I must confess that after all these times, I say that I love to hear a good lecture. I love to hear a lecture, and the lecture of something that might, sometimes the topic, it's important, and the content of the lecture is important, but people are so, can be so persuasive and so magnetizing when they present something they love and they know about, that this can be kind of contagiating all the audience. And sometimes we need to be, I think I'm the old generation. I like to sit, I like to listen and reflect and think about what I am listening. So this time I think is precious, and I would say that it belongs something in the armamentarium as well. I love to hear presentations about how learners, adult learners learn, and how we can also be with the younger generations and learn how they learn best, and see all the presentations that Dr. Pranesh has presented, which are completely attractive. Nevertheless, I would say in benefit of the lecture, that the lecture has a place as well. We can make lectures smaller. We can include interactivity in the lectures. We can lecture about something that will be helpful, for instance, for case-based discussions. And it also depends on the audience that we have. So I think there's a lot involved in the lecture in terms of the formal lecture, about the person who is presenting, about the topic, about the interest of the audience. If people go a little bit to the telephone, it's no problem. The lecturer will know how to, capitalize the attention on their own side. It happens, but there's this movement again, if the lecturer is, someone who attracts and captures our attention. This is just to make, in benefit of the lecture, that has to be a little bit, or can be a little bit undervalued in terms of it's a tool, it's a method, better said, that we can use as well. It depends how we present the topic, the audience, the setting in the timetable. This is my idea.
Thank you, Dr. Helena. Dr. Prashant, I know your institute students show up at 7 a.m., a rather early time. So, and I'm sure you've given thousands of lectures. So what are your little tips?
No, I think Pranesh very correctly demonstrated how lecture can be made very interesting. And I think with the technology, it is even more easier, not just to make your lecture interesting, but also to interact with the participants. What normally we do is that in my classes, my passion is more with the corneal ulcer. That's why you saw those keratitis cases. But if you begin with the problem case and then keep directing them into the new topic or the concept that you want to give, they are very engaged and interested. But I think use of technology is another way that you can keep them always involved. The third is that what Pranesh very rightly showed, that how they can relate their previous experience, and toward that, if you look at the our standard textbook of surgery or medicine. Previous innovators always used to describe it with the common things: cauliflower-like lesion, anchovy sauce, rice water stool. We have seen so many terminologies. They probably were aware of the adult learning principle. The people will be able to relate very well the morphology when they relate to the commonly used disease. And I think we need to go back on that and try to inculcate those kind of things in our lectures.
So for a young educator, Dr. Soumya, would you like to add something?
Thank you, ma'am. Thank you for this opportunity. Like Dr. Prashant sir said, so I teach both undergraduates, postgraduates, as well as optometry students. So we have around 200 undergraduates in our medical college. So it's like a lecture class is the whole 200 are there in front of you. So like probably in an hour's class, I guess 15 minutes would be their attention span, especially the front benchers. And the back benchers, okay, God only knows. So probably what like Dr. Pranesh and sir was saying, if we begin with a case scenario, suppose I'm teaching diabetic retinopathy, start with different scenarios of diabetic retinopathy, and then give them what could be the treatment as then recent advances. But generally what we also follow is we give them some, in this kind of a patient you saw in your OPD when you were posted clinically. So then they would remember, okay, that was the color of the dress, what she wore, or that. So they then related, like, yeah, probably that's how we taught. And also they would observe our counseling skills, and some of them you came and commented, ma'am, you said this way to that patient. So probably that also has just ingrained into their brains. And we also have something called small group discussions in the afternoon, where it's very difficult to say small groups. Like our pre-paraclinical people, they break it into 25 each, and it is just not possible with ophthalmology because some of them are in OT, some of them are in OPD. So we have small groups of 100 people. So we have 2 batches. So there what we do is we give half an hour lecture followed by self-directed learning, something related to that topic. So probably this also would be there, and they would remember that they have prepared on a particular topic. So right now it is fairly going on well, but that's what we do. Thank you so much.
Lovely, thank you. I think with one last comment from Akshay, we were mentioning something, and then we'll move on to the next.
I think to echo what everybody said, and especially when you're teaching heterogeneous groups, something that you did is we often take the audience for granted. We have our set of slides, we have a set of presentations, and the more you lecture, the less is the motivation and drive to sit a week or a couple of days before the presentation, make a new set of slides, look up references, pull out material, go through patients' data, collate all of it, customize it for the audience. Instead, we have a talk on, say, an interpretation of ultrasound or orbital, or any topic. And we use that slide deck for years together, using it for undergrads, using it for postgrads, using it for fellows, for optometrists, and then you say the line, okay, I'm going to skip through these slides, this is not for your level. And then the audience is lost. Like, you haven't taken the effort to reach out to me. And I think you did this very well. You could see the effort you've taken in creating that presentation for us, for this audience. And I think that's very important, because then the audience feels valued, and then they take home exactly the points that you want them to take. So I'm going to say that in my slide also. We cannot expect the audience to do exactly what we want them to do unless we tell them exactly what we want them to do.
Super, super. Point well taken. And so thank you, panel, and we'll continue with Pranesh. If you call yourself a different generation, I think some of us are from a different galaxy.
Thank you, ma'am. So hello again. Right. Can we have, yeah, thank you. Right. So we finished the soft skills. That's what the lecturing skills gonna be actually. Then there comes the software, which we hated actually, right? It keeps on upgrading. So I want to just give some very basic software which all of us use. What is the most common software we all use? PowerPoint, yeah. If we can make use of PowerPoint better, then I think that's more than enough. So we'll try to go through that a bit. Being e-smart. That goes to lecture number 2, the technology in classroom teaching. I've just got a brief summary. The most commonly used is going to be the PowerPoint or Keynote, right? But as you can see that I'm taking this lecture or this talk with a whiteboard because I wanted to experiment with this iPad. If there is one thing which you can buy, the best investment is getting an iPad. It's brilliant. I love it. I got it when I joined Ophthalmology PG. That was the first generation iPad. Only now I have changed. For almost 7 years, it has lasted. It has done me, I've got more ROI from that than from what I spent. It's a brilliant, brilliant thing. And you can do so much with iPad. So versatile. So we'll focus on this slideshow part, which is the PowerPoint keynote, which is what we commonly use. Then I'm just going to show what I'm presenting. The notability aspect, the mind maps. Very interesting, very useful way of teaching students. And finally, just talk about this. I have not personally used much with these applications, but I've used this a lot. I'm one of the oldest users of Notability. I'm a loyal user. For almost 10 years, I've been using this. Before I do this, I just want to show a video how I take class for the students. So I thought it'll make more interesting so that I can walk the talk. These are my students.
What is this? As ciliary body. Ciliary body.
This is for undergraduates. So this may be
and
very
the rest
primitive.
of this is only ciliary body. The rest is called as choroid. Choroid. Again, iris, ciliary body, choroid. ICC, International Cricket Council. Okay. I'm being seen. Why? Because your eyeball is healthy. That's one thing. When I mean eyeball is healthy, I mean this is called ocular media. The media. The cornea should be clear. The AC should be clear. The pupil should be of normal size. The PC should be clear. Lens should be clear. Vitreous should be clear. Retina should be healthy for us to see. It's like, you see, this is a projector. You see light coming here. Okay. Now I'm going to stand there. What I'm doing? Waving my hand. What is casting back? That's a shadow. So I'm a media opacity. I'm a media opacity. I can be a cataract. I can be a vitreous hemorrhage. I can be a corneal scar. So I am standing here, obstructing the pupil is there. Go through the pupil. I'll kick the lens. Kick the lens. Where it will go and fall? Vitreous cavity. Good. So now this is iris, the pupil. So what is this called as? This room is called as? In front of the iris? Antechamber. Now this room is antechamber. Okay. This structure, which arches, what is the structure is called as? Cornea. You get this picture? This picture is very important. I'll keep on referring to this analogy over and over again.
Right.
Good.
Just want to show a small glimpse of how I teach the students there. It might look very basic, but the whole point is trying to engage them, trying to use elements of elocution or oratory there, and trying to make these analogies. The first thing I will say is whenever I teach optometrists, nurses for almost 6 years at Aravind, whenever I take class on anatomy for my nurses, I will say, imagine this room. This room, you have a big ball in the center. Now imagine that. The big ball is the eyeball. What is this room is called as? It's called as the orbit. So for my medical students, I'll just go back there and say, that is a very strong wall. That is the lateral wall. Very hard to break. But I come here and say, this wall, it's like a very weak wall. I can easily knock this out. This is the weakest wall. The medial wall. It's like a paper-like wall. Lamina papyracea. The whole point of what I'm trying to say is bringing this house, bringing the existing props into lecturing. It's a theater art, but really works. Right. Coming back. So what I do is whenever I start my class, the first thing I do is I give this website. So they go like, oh, this guy has a website. But it's not a website at all. It's a very simple to make LinkedIn profile, which all of you can make. If you can create this one, this kind of adds more to your aura as a teacher, so that you show this, they know that, okay, this guy knows what he's talking about. I'm giving because I don't look very old, so students might not, especially UK students, they don't take us for granted. They kind of, who is he? The hierarchy is here, but not there. So we need to give this. The first thing I say is, I've got all these links there. Click on this UG lecture handouts. So I share all the resources with them. I have all my lecture material put as a PDF, and even I have shared with my residents in Arvind as well. This is for the Monday lecture, it's a big lecture. So I give the entire presentation, what I used to teach, as a handout. So now they are happy, they are secure. We have scaffolded them with all the relevant material what they need. Once that's done, I say come back to that website and click on this interactive mind maps. The best way to learn any medical science is to use mind maps. Please, how many of you have used mind maps? Please use mind map. It's like a Zen exercise. I don't just use mind map for teaching, but I also do for my day-to-day to-do lists, for my career plans, and for philosophical journeys. I use mind map. It's a beautiful, beautiful meditation-like exercise. This is one of the things I share with my students. For example, acute red eye. I use an application called X-Mind, which is free to use. It is paid to some extent, but you can see that I can make these mind maps, I can add these images, so make it much easier for them to understand. Right? I shared this as a PDF. So using mind maps, X-Mind is a brilliant, brilliant software. This is one of the mind map which I made for a presentation at Moorfields. I made these mind maps, copied this particular part, and put it on a slide. Look how aesthetic it looks. It looks much better than the conventional PowerPoint what we are using. How we can describe a paper. So I've put a paper there, and what he has described it. Looks neat. Looks like the way how we think. We all think from a mind map perspective. I know that students still will not be able to get this because they might feel that it is too much of information. So what I did was I uploaded that mind map to online, and now they can navigate this. It's a brilliant, brilliant collaborative tool. I put this mind map. Now students, I will say, can you go and find where the scleritis is? Now they can navigate by themselves, and they can find where the lesion is. And they can even add points to this mind map. These are ones what my students added. This foggy, smoky appearance, right? I give them this. Now this will be their lifelong tool for learning. This is one of my students wrote. So they can add to this. It's like an open source, right? Yeah, right. I won't write this, but they do that because for them to understand. So X-Mind or any mind mapping software is a great tool. Notability is something which I'm just showing you, demonstrating how the versatile notability is. This is the software. So everything I make my notes on notability. I upload my ebooks and make notes on the ebooks on notability. Such a useful tool. It is paid, but it's really useful. I make handbooks for my patients on notability. And I take this as a PDF and I give them, I print out and put it on the outside of my cubicle proudly. The doctor, oh, this guy has written a book, huh? Not at all a book. Okay. Just some drawings. But yeah, just to give you that appearance that you have done something. Finally, before we end this, PowerPoint. Just quickly say, Do you think this is a good slide? It's very commonly put slide, right? It's most commonly seen slide. This one? Better? Better than compared to this wordy slide? How did I make from here to what is the transformation? Very simple. Copy this, put it on the presenter notes. Pick the relevant points what we want to make and put it here. Right? So filtering, taking only the relevant words and putting it on the main slide. So when we present it on a presenter mode, we can see this, but the audience will only see this. It's much sophisticated, right? You appear very smart. I will say, CRE is an ophthalmic emergency. It's an ocular analog of cerebral stroke. So I'm not putting this ocular analog here, but I sound very smart. I sound like, oh, analog, he's saying something new, right? So all to trick the audience. Which one do you think is a better slide? I've put the answer there, but second one? Yeah? No? Agreed? How many of you say second one is better slide? Yeah? What I've done is I've just taken this photograph, blown it up, and added elements to this. Another commonly placed table. We all love to copy paste tables into our slides. Like, look how horrible this looks. I can't even see anything. I don't know how the lecturer, but still say risk factors, he'll explain all these things. No need. Take this. It takes some effort, but it is worth it. Put it as a mind map. Put it as a flow chart. Right? So finished Notability, Xmind, and PowerPoint. Thank you.
I was going to give a different note. I said, since you're going to be in the UK, have you considered a part-time career in theatre? So, yeah. So, lovely, wonderful lecture, and thank you so much. Always something to learn and take home or take to the class. So, we're going to go on to the next talk, and I invite Dr. Helena to come and talk about how to improve interactivity in the classroom. Dr. Helena has accepted the invitation to come at really short notice, come really all the way from Portugal for a couple of days. She has been saying that she's going to come for longer because she's very proud of the Goan, the Portuguese heritage part of India. So over to you, Dr. Helena. Thank you so much.
Thank you so much. No sound? Yeah. Thank you so much for, again, Ophthalmology Foundation for the opportunity to be here. Thank you so much for the organization, and thank you to all of you who have joined us today. So this ties with the previous presentation, and we have already seen such exciting ways of using technology to make our message to go across more effectively. I will present a little bit more on the side of not having so much technology on our side. So this is the sad story about lectures. I think we have already gone through this. It's the 7-10 minutes, probably less with the younger generations right now, of attention, and the correlation between what the presenter is stressing and what is taken by the audience, and also the impressive percentage, lower percentage of retainment of the message that can be immediately after letter be presented by the audience. So the objectives are to recognize that active learning expands beyond not only technology. If we don't have technology, there will be other ways of enhancing learning. And we could see in the previous presentation how important it is to have someone who lecturing with active learning, but also that active learning can come so naturally when the presenter is presenting. It depends as well as how much the presenter, the educator, is motivated for the learners to catch the message he or she is intending to come across. And also describing some technology and non-technology assisted active learning strategies. So this is what happens, so it's not a lost case in terms of the lecture. What happens is that we can improve the attention of the audience if we intersperse some bits of active learning within the lecture. And also we have seen this before. It's so much important that at a certain time the participants can have the opportunity to put their hands on either conceptually or in some procedural technique or technology that they can experience, as Professor Prashant was presenting this earlier presentation on the experiential learning. It's so much important, not only the conceptualization, the reflection, but also having the opportunity to experiment. So passive learning is important nevertheless for the learning process, and it's perceived, the knowledge is perceived as a transferable commodity. So it's kind of skills transfer, as we usually used to say. Whereas active learning perceives knowledge as an active experience, something that is experienced by the learners, that they have this opportunity to experience, and they can do things and think, not only do things, but also think, so reflect about the things they are doing. This is so much relevant and supports the idea of the Kolbe lecture, experiential learning, theory of learning that we have seen earlier. And also involves intentional engagement, so people are intentionally engaged to learn about something they will be able to apply in their own practice, in their own reality. And also fosters and nurtures curiosity, discovery, communication, and problem solving. So this goes more than just grabbing information, but also putting that information in terms of an experience that can begin at the classroom in a protected environment, but the idea is to transfer that, to apply that, or to mobilize that experience into the real world. Sorry. So when we are thinking about integrating active learning into teaching, we usually can think about these 5 pillar steps. What do we envision, what we imagine that our learners would be doing by being offered the opportunity to do something? What would be the purpose for that exercise? And what would be the teaching strategies that we would use considering these 3 domains of learning? Are we aiming at improving knowledge, at improving attitudes, professionalism, or skills, procedural skills? So we must think about these 3 domains when we are imagining, when we are designing these moments of active learning. And how much time do we have for this? We have, for instance, an hour lecture, and we would like to, just stop 2 moments, for instance, to intersperse active learning. What we would like to emphasize on these moments, and how would we do that? So examples, very simple, no technology involved, thumbs up, hands up, color cards, depending on the questions that we make. But this mobilized the whole classroom to be active, engaged in what is being discussed and explored. Think, pair, share. In big audiences, for instance, this can happen. Sometimes people think that just by having a very large audience, it's not possible to intersperse and to have active learning. We can do that with technology, for instance, with audience response systems. We can do that with Kahoot now, we can do it with Mentimeter, Poll Everywhere, etc. There are a lot of online softwares that we can use, but we can also do this very simple thing, that's interrupting a little bit, think about what's being explored, discuss with the neighbor by the side, and then eventually share in the large group. The other is buzz groups discussions. Even in this very large audience, a large group, can be broken down into small groups, and these groups would be primed, so to speak, with 1-2 questions about the topic that is being an exploration to, for instance, problem solving or case-based that can trigger the discussion among themselves. And these groups can start smaller, and then like a snowballing, it's about these groups becoming larger when they collide. Not collide, they join other groups and make larger groups into the larger group. The jigsaw exercise is very interesting, for instance, when we are interested in providing some active learning based on a problem solving that can be broken down into pieces. And for that problem solving, the groups, the elements of each group, of each home group, can get together with others that will work in the specific part of that problem. And then when they come back and join again their home groups, they will be more knowledgeable about that piece of the problem that, taken together with all those pieces, will arrive at the solution for that case. For example, we have here prevent complications in context of pseudoexfoliation cataract surgery. And we could see, for instance, anamnesis, clinical examination, preoperative care, postoperative care as the expert groups. And when these elements from each expert group join the home group again, they can be better equipped to solve the problem. Gallery walk. So when groups work together, when we saw earlier, they can arrive at some definitions, conclusions, messages, key messages they would like to share in the large group, and the whole large group can do some gallery walking. Role play, very useful, for instance, for soft skills, for professionalism, for communication, and usually mobilizes everyone and makes a very informal learning space to be. Using emojis, using designs, using images for instance, providing feedback at the end of each presentation that can be self-assessed or not. Brainstorming, when there's a problem and people work together, for instance, in a large group, and they can have ideas that they can post very simply, and all are engaged, even if they are a little bit more shy or difficult to participate. Other in small groups or in the larger group, they have their idea and post it on this flip chart, as you can see. And then it's very interesting, for instance, to go with these ideas and cluster the ideas into clusters of themes and arrive at some conclusion. This is very involving and engaging for the whole group. And then games as well. For instance, just having some dice and rolling the dice can give the opportunity of different groups working in groups, in small groups, with slightly different case scenarios that can engage the group, as you can see here. For instance, if you have for the type of cataract and your dice roll just says 1, you will have this polar cataract, or for the eye examination, the pseudoexfoliation, and by that, the case scenario will be different for the different groups. And simulation, of course, there is either here is presented as for the procedural, and usually for ophthalmologists, we immediately associate simulation with procedural skills, not only surgery, but usually surgery. But we can also use simulation for conceptual skills, and usually also, for instance, simulated patients, virtual and gamification as well, to create scenarios providing different cases of professionalism, communication, patient-doctor, etc. In summary, Having this is a mindset. It depends a bit of the presenter, but also it can be learned, it can be taught if the teachers and educators are willing to take this mindset and task. Exercises communication, so it goes beyond information, it goes beyond knowledge, so to speak, and also it brings with the other domains of knowledge that are attitudes and also skills, and involves collaboration, problem solving, critical thinking, and not only providing information. Benefits from organizational recognition. Then this is very important. For instance, you have seen that having a fellow or being a fellow is an immense excitement, because it provides you the space and the recognition of the organization that you are doing something that is undoubtedly helpful and valuable for the next generation of ophthalmologists, in our case, to be better providers of eye care. But sometimes this is not the case, and you have to be a little bit as a kind of a spearhead flag for that. And it's so important that sometimes I always remember that image that you have the kind of someone who starts from nothing to, just dancing the beach, and no one understands why that person is dancing on the beach, and dances for a long while, and it starts to be a little bit uncomfortable for the one who starts dancing, because it was so, it was so gray, and it's not fun to be in the beach without having anything to do. And all of a sudden someone joins, one person, and there are two dancing, and then there are 3, 4 snowballing people. But so it's difficult for the first one if you don't have the recognition, but the message is not to give up and to find someone who can also feel, and you can inspire someone to feel this is important for the next generation of eye care providers, because if they learn well, they will be better professionals. And faculty development is needed, and also the Ophthalmology Foundation with the program of training the trainers, of the programs that Professor Karl Golnick presented. The one that we are having there, this opportunity is also in this framework, and also requires integrated implementation in curriculum. So should be recognized by the organization, and should be kind of a culture, and not only something that just, it's kind of a whim of someone who would like to teach a little bit different. Learn, participate, and create. Thank you.
Thank you, Dr. Helena, for that really illustrative talk. We'll take a pause here and discuss the first 2 topics that we have covered. So I want to know from the audience, so while I pass on the mic, I want to welcome Dr. Tinku Bali, who has come from the ARC, member ARC, and Dr. Rashmin Gandhi, who is a legendary teacher, known world over. Thank you for joining. So we're going to talk about what technology do you use for your teaching, and also what about how do you bring in interactivity, Dr. KP?
No, mine is actually a question about the second topic, the interaction. See, I teach around 30 students, half of them are DNB postgraduate, half of them fellows. However interactive you want to make it, I find, too very disheartening, they're very passive. The present generation, I don't know, I want to just ask the others about the experience. They don't come prepared for the class. Number one, they are okay if somebody else answers. That earlier when we were students, we used to be the first one to raise the hands and answer the question to get brownie points. Nobody cares, because they say they can always go back and probably look it up or something. Presently there is a tendency to be laid back, probably to look at it later, or probably answering a question, forget about asking a question, has always been a lost art. I just want to know everyone, because there are many people from the medical colleges also, like what has been the present scenario, is it the experience of all, and what we can do to probably circumvent this.
Give a lot of talks and lectures.
I think most students nowadays are very underwhelmed by whatever we do. I think whatever tools you use, whatever mind maps, they're not like, we used to be overwhelmed by all this, and we used to be so excited, and we used to keep our teachers on a pedestal, although we both are not that old. You're right about the generation gap. And nowadays they couldn't care less, one, and they're not really impressed. They are not impressed with anything. Whatever you go do theater on the stage and tell them about the walls, they're not impressed. It's very difficult to impress somebody who is constantly needing stimulation. They are, I think, hyper stimulated by social media, I think, and that kind of dopamine rush is not there, is something I have diagnosed. I think they are underwhelmed by whatever, they are not impressed no matter what you do. And like Krishna Prasad sir's, exactly, there's no fear of losing information. Yeah, and there is that they don't want to impress anybody. It's like each one is a king and queen, and everybody is a star, and I don't have to impress you. That's why I don't have to answer your question. I think that's something, I remember being like mesmerized by Dr. Krishna Prasad's refraction tutorial. It's like jaw is on the floor. Dr. Rashmin's lectures on neuro-ophthalmology, I can never forget progressive supranuclear palsy, Parkinson plus, I can never forget. That's something, it just gets cemented in your memory, and we were so impressed, and we still are. But now I don't think you impress residents anymore.
I wanted to thank you actually. Okay.
Welcome, Dr. Prashant. Come on, the man behind the show. Yeah, please just say hello to all of us in your busy day.
Hi, good morning, and thanks a lot for being with us. In fact, I should thank the ophthalmology program for associating with AIOC, and I take the opportunity once more to thank you on behalf of AIOC for associating with us. And naturally, the whole show is being conducted by all these big people, so I don't have to even look into this all. Thank you. No, I'm not speaking.
Okay. Sorry, I interrupted. Thank you, Dr. Prashant. Anybody wants to comment? How do you impress the
I liked a lot this last intervention, because I feel exactly the same, which is the democratization of information and the ease that people get to the information has this side. And it makes us think how much this generation is different. How much we were so attracted by the lecturer, the role model, the mentor that we have and still inspire us, at least me, still inspire me in my clinical activity and educational activity, whatever. And how this new generation, if this is the right designation, thinks about. It's very easy for them to go into the information, images for some clinical problem, even at the OR, and they immediately have some, decision, they arrive at a decision, at a diagnosis, at a management plan, and it's kind of, if it's not needed, which is kind of, just kind of a chilling thing, not learning anymore, because the information is there. You just have to grab the information there, and they have this critical thinking in terms of appraising if the information is coming from a trustful source or not. So this is very important. When people say, "Oh, that comes from Google," "Oh, Dr. Google," but the residents know where they should find information. So. What really moves them? What would excite them? This is. I was, for instance, I was listening to Professor Prashant Pranesh, and I was thinking to myself, "Wow, I learned because I had to learn. I would like to make a good, a good figure of myself, of just honoring my mentors and I would like them to trust me, and I would like to, to earn my place. And now we tell them everything. We have to imagine that this is the anterior chamber. So I had nothing of this. And especially when we come to the postgraduate, the residents were responsible for presenting the morning rounds, and they were responsible for that. So this makes us think as how it is going to be, and with artificial intelligence, generative artificial intelligence, and all that. So what's going to be in the future? This is how so much important it is to magnetize their interest to come to these kinds of meetings and spaces that we can speak and explore about health professions education and medical education, so we can learn as well a little bit from them, which can be difficult because once they know, they just fly another place. So it's just like birds flying, and they discover the quiz, and then they just fly away. This is my experience. So thank you so very much for bringing that up, because I think this is something. This is kind of a groundwork that it's needed to be taken in consideration when we are speaking about all these techniques and about if people don't hear those who can. There are still TED Talks, right? So there are still people who can capture attention of others. So in terms of lecturing, so thank you.
Dr. Elena, I think one of the things that caught my attention now was how you mentioned knowledge is so readily available that learning is now less, because all a trainee needs to know is where is that knowledge that they can access. And more importantly, at some level, they are a little more advanced beyond us in assessing, is this knowledge useful? Because I was, I remember during, so I'm an oculoplastic surgeon, and my favorite quiz question that I always ask all the residents is, in thyroid eye disease, what is this sign? What is that sign? What is Darrell-Impel sign? What is Mobius sign? And a resident actually asked me, what is the importance of knowing these signs? Why do I need to know what is the name of this sign when I know what it is, when I see what it is? And I didn't have an answer. So they are able to flush out what they feel is important, what is not. And we also need to now be a little more adaptable and flexible in doing that. The other thing that, we traditionally used to have these case presentation where someone would present a case, talk about the signs, the investigations, a diagnosis management, a review of literature, a discussion, a take-home principle, and then the conclusion. Residents nowadays are being very innovative, flexible, and you need to somehow allow that innovativeness and flexibility to express themselves. Like the way Pranesh has broken the mold in how we are presenting. A lot of these guys also end up doing amazing stuff. So like the more we teach, the more we end up learning.
I'll flip the question. If there was no exam for postgraduate, will they read?
They read what they like. They read what they like, what they want, which stream they want to go. But as a holistic
If there is no exam,
approach,
if there is no...
as a holistic or seeing the patient as a whole, I doubt that's
No, will they read for the idea of becoming better?
Dalrymple has to come make a TikTok video and say that.
Yeah, so first of all, thank you so much for flattening my ego, completely saying I no longer impress. But what I think, what Akshay partly mentioned, is it also presents the opportunity. Because we know exactly what excites them. It's like, in one of the talks, what we had discussed is that it's like, it's not that they're no longer wanting to watch a movie. It's just that they don't want to go to theater because OTT is available. So they can watch it at their own pace. They can go back, come back. And I think that presents an opportunity to modify our teaching, which they absorb.
I think it all, what I see at home reflects what is happening in the classroom. That is my 25-year-old. 3 or 4 years back, whatever I said was wow and cool, dude, and now it's all meh and mid. There are only 2 words that exist. But inside closed doors, she's all excited and animated. And I asked her, what is going on inside? So basically, I think we need to find out what excites them and what, I don't know, I don't think anything will inspire them, but at least what is something they think is cool and fun. Any more ideas? Helena, you wanted to say something?
No, I really feel that assessment drives the learning. So assessment is required, definitely. They will learn what they want to learn. And one more thing is that they don't have social interactions the way we used to have. Like I just went for an exam, I was an examiner, and I was going up in a lift to the 5th floor. I found these young residents surrounding me. They didn't know who I was. And everyone was on a mobile on social media. They don't greet each other, leave alone anybody. So they're not bothered. They're in there with their mobile. So this is one thing which is very responsible for this lack of attention span or whatever they have. They're glued to a screen all the time. So I don't know. That is quite scary again, because social interactions are not there. Or it's through virtual interaction, but actual physical talking is not there.
I think we just need to change with that and adapt to this. We can't be our uncles and grandmothers and start complaining.
No, we're not complaining, but if you see that, if you want to at least greet somebody, yeah, or something, and most of them are sleep deprived. If you see that most of them are so glued to their screens, they're not sleeping at night. So this is one thing which is really taking toll. I really feel that. So this is.
So one more comment from you, Dr. Hannah. We'll go to the next session. Thank you, but point well taken.
That is hands-on, I think, still, excites them. Like surgery, for instance, that is the only thing that I've seen when they really, they have that spark of excitement in them. Anything that they get to do with their hands. So, I mean, we should have more hands-on teaching, rather than plain didactic teaching. So I think that's the only thing that's going to spark their interest when they're involved in doing something on their own.
Thank you. I take the opportunity to welcome also Dr. Kaushik Murali, young educator from the Shankara system, who again I have unloaded a talk on him, and he's not happily or readily agreed, but thank you for agreeing.
That's a good point as well. And that makes me think if sometimes they are fully aware that they are operating patients and not only eyes, because I can feel they are so light. They are so light. And when we are by their side, we are, when would you like me to? We should switch. Just a little bit more, which is, I think it's food for thought. I think this will not be probably solved today here, but it's something that we should think about in terms of the future, and how this bridge can be built better, because it's certainly a different way of looking at the profession, at looking at the camaraderie in the profession. How the profession can serve my own interests, and how I can learn the best to be, for something that will be a definite outcome in the future, a definite, I would say, output and somehow outcome as well. So it's about empathy, to be in their shoes and think what would be better to. Probably not everything is good in every generation, and probably again here, and probably something that the older generation, I am the older generation, bring, probably can also be, even if difficult, even if they don't like, but well, we learn this way. This is our story. Probably it will be a good story, and probably will inspire others or attract others. I like inspiration. If they aren't inspired, I can feel a little bit lost. Thank you.
Thank you, Dr. Helena.
Is the present system leading to half-baked, less effective eye care professionals?
That's a topic I think we should discuss over lunch. No, it's just that I think we should get on with the program. So if you don't mind. So to see whether flipped classroom is the way to work that magic to get them excited. Over to you, Pranesh.
Thank you, ma'am. Now I want to be empathetic with the timekeepers. I want to put into your shoes and think, are we on time? I think we have to close at 11:45. We are okay? We have Prashant sir's talk also left. I want sir to talk about AI. That's much more. That's perfect. Great. Brilliant. I agree to my seniors and the esteemed guests that the generation has changed. I know it's frustrating, but I still hold by my students. I may be the odd man out, but still I believe that we have changed the way we treat our patients. Are we still treating the patients how we treated them 10 years, 20 years back? No, things have changed a lot. It's a patient-centered healthcare. It's a student-centered education. That's it. So yeah, so after they, can I have, okay. So after they dance and drink and they come for the next day's class, they sleep off. Now we're making them learn. We are giving them some material so that read and come. What do you think is the biggest negativity or the bad thing about flipped class? Flipped class means we're just flipping the class. We're giving them the topics beforehand. So what do you think is the biggest drawback? Sir? Suspense is lost. The number one reason why flipped class fails. Yeah, exactly. The player should train in the practice field before they come and play cricket, right? It's IPL, and what if they don't train and come? There is no cricket happening, right? The umpire is lost. What the hell is happening? Audience are also clueless. So, in fact, the lecture is going to be like a cricket ground, right? In this regular class, so we are the teachers are going to be the players, and we have the audience watching us. And whether you want to play Test cricket or T20, it's up to us. Which draws more attention? IPL, not Test cricket, right? So that's important. But here, sir. Exactly. Exactly. That also fails. You're assuming that we are preparing under that assumption. So the onus is now on the students to learn. So are they preparing? If they don't, the flipped class fails. That's a disclaimer. But we're assuming that they are preparing. Let's move on. The flipped classroom. I'm coming back to the conventional slideshow. I made this, wantedly because I want to get a feedback from you, whether you like the whiteboard one or this. I want to get a real-time survey. Right. So we all know what a flipped class is. How many of you have conducted a flipped class? Brilliant. 2, 3, 4. Good. I've been a participant, I've been an audience of a flipped class, and I've conducted flipped class. I've been at both the receiving end, and I know it's a struggle to be a student in the flipped class. The anxiety I had to undergo when my professor asked me a question, right? So it all depends upon how well I prepare, and I have always prepared the day before. I'm guilty of that, sir. Yeah. So it's simple. So in a traditional class, the lecture happens, then we give a homework. In flipped class, it's ulta. You remember this ulta perk? This was a nostalgia. It was a very nice strategy. Ulta perk means they will have the chocolate inside and the nougat outside. So essentially, flipped class is ulta class, right? So there are 3 levels which I always try to bring in when it comes to this flipped class. Quickly, the level 1 is priming. That is where the most of the efforts happen, like what sir said. Our efforts, teachers' efforts and students' effort, everything happens on the first level. That is priming their brains to read for the class and come, which is the biggest struggle. But how we can make it happen? I always overdo this. What I do is, I do a lecture, and fortunately there'll be some of lectures we already done before, so I give them to the students beforehand. Hopefully they watch them. But it is 48 minutes, nobody will watch them. Now they have Instagram generation, right? So I've now made these things into small reels and I give them. So those who want to watch 48 minutes, they can watch. Those who want to watch 1 minute, they can still watch that. So I give them an option. That's where we have to be strategic. I know this is too much on our efforts as a teacher. This is not my job, right? Why should I make this and convert this into multiple short reels? But if that's how the students learn, we have to go to that. This is a controversial statement. You might agree to that. It might be overwhelming. Right? But considering that we take that effort, how we can easily make it? How we can give a very simple video? Simple. Record the screen, attach a microphone, and talk as you move through the slides. We have a PowerPoint presentation ready. Now that is a multi-purpose thing. We can use it for your YouTube channel, right? We can also share that to our students. Students also can watch that. If you think that it's a bit of a trouble, a time-consuming process, we can do this. Open the PDF or the PowerPoint, share it as a PDF or a presentation, give to the students beforehand. This is the simplest way of flipping the class. This is something which I did for the flip class, what we had for amblyopia. So please look at the variety of, this is a DOS article, which students love, postgraduates love to have this. I'm giving different types of articles. One article is a question answer. One article is a study. And you can see that another article is going to be just a flowchart. When you give this variety of options, this is cafeteria approach. Choose what you want, but read and come. I don't care whether you read the day before or 20 days before, but you will have something to read. You will not have any excuse not to read because I've given you everything. The ball is in your court. That's what I'm trying to say through these materials. Participation. Whatever Professor Helena was saying. Use all the tools and strategies to participate. In that amblyopia flip class, we had case scenarios. Excellent way to bring problem-based learning. Make them talk. Here, the players, the cricket players are the students, not us. Debates, wonderful way to stimulate their knowledge. Go crazy, go creative. We have so many ways of making them interact. One is called as Mentimeter, which Professor Helena was mentioning, which I can show at the last. Which is a very useful tool. Mentimeter is very simple to use. How many of you use Mentimeter? Okay, what? It's a brilliant tool. I would highly recommend you to use. Very easy to make. Mentimeter. This is what I do as a first thing. What you had for breakfast. So students can log into this. Okay? Even now you can log into this and you can type, I had idli, sambar, vada. Okay? So this is called word cloud. This gives lots of responses. This was icebreaker. The very first question will be an icebreaker. What is your favorite flavor of ice cream? You will think these are all irrelevant questions, but this kind of captivates retention. We are trying something different, going to their level and trying to pick it up. At Moorfields, before they do any talk, they put up this for any lecture, for any audience. It's a nice way to warm up the audience. So that's the key. Divide into roles and groups and make them engagement. Just share some of the things what I made for my students. This is one of the MCQs which we made on thyroid eye disease. Students would prepare and come. I will give this entire PDF. They will do this MCQ at the onset of the class. And we use this document to discuss the class. This is one way of flipping it, using a quiz, using a multiple choice question. Another way is, for my students at Moorfields, we give this entire PDF 1 week before the class, or even 2 weeks before they come for the placement, and they read and come, they prepare and come. Hopefully they prepare and come. By the end of this week, we discuss this. I go through this. So what I do is, I take this PDF and I make it my own way. I use notability, like I discussed. For example, I make it a much more interactive way. I mask these, then I ask questions. So easy to make. Doesn't require much efforts at all. Then I give this as a PDF for them as well, as a post-thing review. These comics. So make it more interactive, make it more interesting. That's the whole point of it. Rashman sir would be knowing about this. Experts in teaching FICU, FRCU, we can capitalize on that. Exams is going to be the hook. I understand, accept that without exams they won't read, sir. I won't read, for sure. Exams will be my immediate relevant goal. That's what I also use the same strategy for my students as well. I know my students in UK, they prepare for this UK MLA, something like a US MLE. They have an exit exam. I took pain to understand what question bank they are reading. They use something called as PassMate question bank. That is what they read. Then I go to the PassMate, I subscribe for that. Then I took questions, then I photographed those questions and it put it on my folder. This is the PassMate. See that? I was very surprised the way medical students are learning ophthalmology. Do you think we will learn this? Something which I will learn as a PG trainee, but not a medical student, but they have to do this. So then I use this as a format to teach them. I use this in my flip class. What I do is, I take one question and I prepare a lecture out of that. This is one question. Take one question and make a video out of that. Right. The last level is, we are stimulating them to produce something new. What is the output? They have prepared, we have interacted with them, but what's the output? That's going to be the key. Give them an assignment. Extend the flip class beyond the classroom. This is one of my students, she was here now, okay. She's not here. She prepared these notes after a flip class. Notes for her exams. Not everybody will do this, but we can just point and say, you can make this, it will help your exams. Exams, hook. Retrospectively, what I could have asked from my students is that, go to iPad, open up App Store and try to see amblyopia exercise apps. That would have been brilliant. Capitalize on the youth. They have an exuberant energy. We have to make use of them. I know that we are frustrated, but that's how they are. Like ma'am was saying, her daughter, there's a big generation gap, right? So daughters don't listen. If daughters, our own sons and daughters don't listen, how can the students listen to us? Right? That's the Ulta class. Just want to end it here. Easily, we can flip one level at a time. Don't have to do everything. Prepare a class and you can just give a PowerPoint beforehand. Let them prepare, let them have the class. I hope it was clear, the flip class. Thank you so much again for the patience.
Thank you, Pranesh. My daughter has a sticker outside her room permanently saying, I am in a meeting. Okay, so that's about it. That summarizes it. And the way we communicate next room is by texting. She says, don't, Ma, I will read what you send me when I have time. So no need to talk. So like you said, it's a different generation. But I welcome Dr. Grover, legendary teacher and a big catalyst for education change in India, in the All India Ophthalmology Society. Welcome, hearty welcome to you. We next move on to the last talk before the tea break. The tea break can happen as soon as the talk is over. The much awaited AI in education. Is it a boon or a bane? Over to you, Dr. Prashant.
Part of the talk is already, or the ground for the talk is already set when we made a remark that the iPhone is a distractor. And I think post-COVID, there have been a lot of debate around how technology is impacting the education. What I'll do is I'll just flip through some of the slides and then we probably can start some discussion around what each one think about artificial intelligence and education. The objectives of my talk will be to talk about to look back and understand how technology has influenced our daily lives as well as education. And then talk about what are the fears or the apprehensions about the generative AI and education. Share with you some of the thoughts on pros and cons, and then if we have to live in this world where AI is going to be a reality, what are some of the things that we can do to prepare ourselves adopting in this new world full of artificial intelligence. And I think if you look at this slide, you will see that we definitely have been benefited from technology advances. I don't know how many of you lived in villages. In my early childhood days, to travel from train station to the university campus, which was 10 kilometers distance, we used to take at times the bullock or the camel cart, because I was in Rajasthan, and it used to take almost 3 hours to reach home. There was only one bus plying between railway stations. Our lives have changed. Today, in 3 hours, you can cover 300 kilometers without much difficulty. Think about the clothing industry and this huge revolution in clothing industry as an example. How many of you wrote on these taktis in your childhood? I did it. And today if you ask me to write even on a paper, I find very, very difficult. You are so tuned on writing on the laptops. I'm sure we are seeing AI in this perspective, and after a few years, we all will become very, very comfortable in using and making best use of even in education. My belief is the technology continues to be an enabler in every aspect of our life, some with our knowledge and other even without our knowledge. How many of you wrote thesis sitting in the library? I did it, and it was so painful to go through the books, journals, keep cribbing every day, cursing the professor when he or she is going to check. Today everything is available on the media, and you can just download pages and pages without having to go through the pain of sitting in the library. I still remember one day I scolded librarian who was pushing me out of the library because time was over. I am sure the next generation will not know how to use pen and pencil. The day is not very far off. We all have seen how technology enabled continuity of education in the COVID time. But despite all of this and the benefits that we have seen in the education fraternities, there is a debate going on whether an online mode of classes was better or the offline mode of classes is better. You search on, you will find multiple articles, including some of the management schools are debating on what should be the best format of education. And in October, when generative AI was launched, the debate became even more heated because there were fears among educators that this is going to change the whole perspective of how the student will use generative AI versus how we are going to prepare them from the threats of generative AI. The propagators of artificial intelligence are saying us that using generative AI in education is like having a robot as your companion, who cannot bring you coffee when you are tired, but can help you print 10 pages of your lecture in 5 minutes. So you may not need even the coffee to relax. But despite all of those, I think all of us sitting in this room are very apprehensive about this new tool and the way we are going to see students coming out or using it in our system. And this slide summarizes some of the thought. There are ethical concerns, there are concerns about how are we preparing our students for the future. And we already saw the debate that students are not bothered about education. They are not motivated. Nobody can excite them. All of these are the current fears of using AI. So how many of you in the hall feel that AI is going to be beneficial in our education system? How many of you feel it is going to even further reduce students' attention and effort? Nobody. So all are optimistic. My talk is done. Now there are several advantages. I'll quickly go through because I think they just give you some idea. I'm sure all of you. Access of information is going to be at the tip of finger. You just need an internet. You go to any GenAI portal, type your question, and whatever literature has been used to generate that, it will compile all and give you, you want 1-page summary, you want 10-page thesis on it, it will be ready in no time. So I am sure that going through the pain of looking at different journals, searching the topic will become even easier. At present, while you can use PubMed or Google, the generative AI is going to make it even faster than what we are saying. Most of the learners will use AI for personalizing their learning. If there are certain way that they want to learn a topic, they are going to be using that. And AI is also going to study how a learner is learning, what are the topics they are browsing, what are the common methods that they are using. If you keep looking at the images, charts, the AI will constantly feed you with the charts and pictures. If you look at text most of the time, the AI will push text to you. So in some way, the students will be using artificial intelligence for more personalized learning. It will also facilitate collaborative learning opportunities. I think the people, for example, Google Share is one of the ways in which people are using. I'm sure with the AI, it will be even more easier to use your text and get the input from the collaborators, from the other partners, and improve overall learning experience. Part of our work as educator will be taken care by the AI. You need not prepare the class roster. You need not prepare all of that will be done over a period of time by using artificial intelligence. And you will have much more time at your hand to really look at the educational content. Probably the quality of content generation will be much better. Today, if Pranesh technique I use, I will struggle. I am sure after some time, if I get mastery of generative AI, that tool will provide me all these PowerPoint slides, use annotation, and then keep on interactivity, which at present we have to learn. But I am sure that I think the content generation will become. The other advantage as educator will be you will generate huge amount of data for each learner. And you will be very objective when you say a student is not progressing well versus they are progressing well. But there are caution that are required. While the whole field look very exciting, there are some threats. I think we all have seen the benefit of mentor-mentee relationship and how it not only provide you educational content but transform lives. And that personalized learning experience will disappear with the artificial. Artificial intelligence does not have that. We have also seen the digital distractions. When we participate in webinar, after certain time you immediately look at your messages, your emails and all of that. They are very easy distractions. I think one of the major fear that most educators have, the critical thinking will go away. How many of you have experienced that in earlier era you remembered all the phone numbers. Today if you ask me my wife's phone number, I probably will fumble. Don't convey that message to her, she is going to kill me. I think when you start using less of the mental power, the ability for you to exercise that in real life diminishes. And I think evolution has taught us that how much problem you face, you try to find solution to them and start becoming better. But if the solutions are given by machine, then that capability is going to go away. The cyber security risk, already there is a significant increase in the cyber security. And now you can think if the machine start looking at your behavior, the machine will also pick up your vulnerability. And that is going to cause significant threat to the next generation of learners. Since we already talked about majority of them are sleep deprived, there are many other health related risks that are coming which are related to the posture, their behavior, and all other concerns are there. Now those who have access to technology will continue to get educated more, but what about those who are not having access to technology? So haves and have not, the gap will keep on widening, and we probably will be creating a society which will be very fragmented, and that will cause its own problem. And that's what is another concern educators have. And the last point, Helena said that we do not know what source that AI tool is built on. And if they are not built on reliable sources, the generative AI will develop content based on whatever resource you have put into. And therefore reliability and biases can influence a lot of that. So consider AI integration thoughtfully with a focus on enhancing educational experience rather than complete replacement of existing situation. And therefore we need to make ourselves ready. First, integrate or accept that we need to all learn the nuances of machine learning and artificial. Our curriculum should have some content related to AI so that your learners can be made aware of what this technology is. And I'll also extend that we should also participate in some research so that we can generate evidences which are relevant to our society. We should collaborate with some of the technology industries so that we can get input from them rather than just limited to the healthcare professional. It's a very technology intensive area. And we should also have in our organization some of the ethical kind of guidelines so that the students can be guided accordingly. With that, I think what I'll say is that we should embrace AI as a tool. We have always embraced different type of technology. It is an exciting opportunity. Yes, there are concerns, but I am sure over a period of time, we will be able to find solutions to those concerns as well. Thank you very much for your time.
Thank you, Dr. Prashant, for giving us a glimpse into the future. This is, of course, a very, very hot and relevant topic, open for discussion. We are running just a little behind schedule, no worries. I take this opportunity to welcome Dr. Parikshit, and again, a very excellent lecturer and researcher, and our young educator, Dr. Rolika, come all the way from United States, the middle of her fellowship. Welcome to you as well. Let's discuss flipped classroom. Any thoughts? Would you do it? And what about your thoughts on AI? Dr. Ashwin.
So I just had one open question that, now AI can generate an abstract for you, an article for you. So would you allow it? Because on the face of it, what student would have taken 2 months, 3 months, 4 months, he's coming back in a day. So what do you think?
No, I think without effort, if a content is just copy pasted from the generative AI tool, is not going to help them, and that is unacceptable. But I think if that same thing is given as an exercise for finding answer to the question and then added to some activity that they have to do on their own, they will not only learn how to use the generative AI, but they will use it constructively. So I know I am a little diplomatic, but we will have to slowly start adopting to it.
That means natural stupidity is better than artificial intelligence. No, sir, I just slightly disagree with what you said. I thought AI will provide a level playing field. You said it's going to widen the gulf. I would rather say it's actually an equal opportunity because it's not very cost intensive. It probably gives an opportunity for everyone to access information. Would it be that way?
I think while all of us look from the perspective of where we are today, the COVID era, the students who had very poor internet, no access to computers, completely lagged behind in their education. Do you think the person or the company who is creating generative AI will give it free of cost? I am sure after some time it will have cost added. Those who can afford those costs will get a better resource as compared to those who are not able to. We are seeing that divide in our society widening. Unless the government take very serious actions on these, the divide in the education, which is our fundamental right, is in my opinion not a good in the betterment of the society. I still feel that AI also is going to widen that.
Knowledge and wisdom are two different things. You can get all the knowledge at a click of a button very rapidly. Unless critical inputs have gone into building that, that is where the deficit will lie. So wisdom has been defined as what is left after what has been learned in education has been forgotten. So it's the process of developing that critical sense, being able to analyze things, being able to put them in perspective, which is what is going to be lacking. So both have to be combined. That's where the role of educators comes in. That when AI comes in, we merge it so well with the critical thinking, with analysis of that and putting it in the right way so that the education continues.
Just wanted to make 2 points. First is, while we may think that we cannot permit AI in education, we are still not at a stage where we can develop another generative AI which can discriminate between AI generated content and not. It is, but not at the level of granularity with which it can absolutely differentiate new data versus data that has been prompted very, very well. For example, abstracts. Now you mentioned one place where I use AI in writing abstracts is when you have the same data set. Now obviously the AI is not going to go through your Excel sheet, come up with your conclusions, do a data analysis. You would have to do that yourself unless you've paid for and gotten it done through somewhere else. Now you've come up with your conclusions. Now AIOS website says 1,000 characters with spaces. The AAO website for the abstract submission allows you 1,000 words. So putting in all this data there and telling them, okay, can you come up with an abstract that is 1,000 characters with spaces, and then using that abstract. Now, the data is true, it's genuine, the conclusions are genuine. Can that abstract be rejected by saying that it's AI generated? So where the line begins and where it ends is getting blurred.
So the definition of plagiarism is becoming more and more wider. And I think there was this debate generated when some of the papers write generative AI as one of the authors. So I think we are entering in that era where these questions are going to. My son, who is doing his MD, recently told me that he put the data on certain platform and the entire page on the result was written. So imagine, that's where the worries are, that will the student learn how to write the result section? If there are those tools, he said all the graphs were made, all the tables were made. So yes, I'm not saying that we should all just go gaga about it. There are concerns, and there are serious concerns. And they are centered around how many capabilities you want to build in your learner, and whether those capabilities will be built by asking them to go through that activity, or they can just copy paste from the generative AI and lose all the perspective.
This is truly AIOC.
Yeah, all right. That's a good one. On that note, we are going to do a quick distribution of certificates for the participants of this session, and then we'll take a 5-minute tea break. Yeah, please pick up the cup and come back to and keep having it here. Okay, so I'm going to flip roles and call our young educators to come and distribute the certificates. First, I call upon Dr. Apurva. Okay, that needs a lot more discussion. No, I just said young educator. We're not talking about anything else. Yeah. Dr. Prashant Garg. Wait, you're not done yet. Dr. Apurva. She got so excited. No, we're going to have 4. Dr. Helena Felipe. Dr. Tinku, please. Please, you have to finish 4. So excited after every photograph, she's running away. No, yeah, please. And last, to Dr. Saumya. Yeah. And you stay there. And thank you, Apurva. And Dr. Krishna Prasad. And to our superstar, Dr. Pranesh. And to Dr. Meenakshi, myself. Yes, we take a short break, and if you'll all please assemble back in about 5 minutes, grab your cup, and we'll continue.